Okay, so first, I would like for you to introduce yourself, your major, year, where you're from.
So I'm Heather Kaskey. I am currently a junior at Temple University and I'm a public health major. And I'm from Westchester, Pennsylvania, which is roughly like 45 minutes out of the city.
Okay, I've heard of it. I've heard it's so beautiful.
It is. Westchester is it's a great town, very small, but I'm grateful to have been in the city though.
That sounds amazing. Um, what inspired you to pursue public health, and how has your background in psychology shaped that journey?
So I feel like because I had originally been a psych major for a little while. And after being in there, I really started to learn about certain information in the world, how situations impact people. And I started to research public health, like specifically like the social detriment of health and how all these pieces of the puzzle come together. And it kind of just pushed me a little bit in the right direction down a different path that I honestly had no idea about. But ultimately, I love public health because I feel like it encompasses so many different things. Like outside of obviously we have infectious disease and things like that, but certain societal aspects that play into health. And I really love the research with it too, which I think we can go so many directions in. So hopefully when I get a little bit older, I'm a part of that.
No, I mean, you sound very passionate about that. So it seems like, I mean, we need people that are passionate about things, just
Yeah.
not doing things just because someone told you to do it, or, you think
Yeah.
is what's best about maybe the benefits or whatever. So I'm glad you're passionate about that. Um, can you talk about, how Temple has supported your academic goals or influenced your perspective on wellness?
Definitely. So it wasn't until I had switched into public health and I had the opportunity of taking different courses and connecting with my professors in the field that I really felt empowered and motivated, but most importantly, comfortable
Hmm.
to pursue different or not different, but more outside of the box thinking. It was the first time that I'd ever been with professional leaders and older adults where that shared some of the same opinions as me. And I was so not used to it. And being in that environment really pushed me. Same with I'm a part of the Wellness Resource Center and learning about different organizations. Like we have a drug prevention group and just seeing certain things that to other people and outside world might be a little bit questionable or like, oh, I can't believe that they're teaching that. Like I had the opportunity of going to a harm reduction panel and I absolutely loved it. So Temple has definitely has helped me grow, but also given me a change in perspective that I never thought possible. And I'm so grateful to Temple and all the amazing professors that I've had that have helped shape me and push me to where I am today.
I mean, you've definitely had successes on, meeting people and learning and expanding your knowledge. But has there been any challenges?
So I would say that up until probably recently, with the uncertainty in the world and the political environment, seeing the stress and I guess the barriers that some teachers have to come across, especially like I know that there's an issue right now where certain courses, like the titles are being changed, certain curriculums are being adapted because of the pressure from, like I said, like politics and outside world. And that has definitely been discouraging and challenging and a little bit scares me a little bit. But at the same time, because I have these amazing professors who still persevere and push through regardless, who open up spaces. I've had a professor of mine that completely canceled class back in November. And he was like, listen, there's a lot of things going on. If anyone wants to come in here and just talk about how they feel or fears that they have, it was so refreshing and so comforting to know that, these people, regardless of what's going on, they care. And I think that that has definitely just been a challenge with the uncertainty of where this is going to go. But ultimately, I'm confident and I have a lot of hope for us as like the student body, because I really do, and our teachers. So
Definitely.
that's definitely one of the very few challenges that I face. I'm always supported. I'm always, being pushed to have outside thinking, to use a different perspective, because that's the best thing that you can have is be shameless in critical thinking.
Just think what you think. Yes.
Yeah.
Uh, what first drew you to studying the war on drugs? And was there a specific moment or class that sparked that interest?
Definitely. Actually, it was my health communications class, and we learn about the situation in Kensington right now and certain factors that influence that. So once I learned about the war on drugs and how this pushed out this very harmful and hurtful stigma for people who use drugs and are experiencing certain, aspects of life, it really, I don't know what the correct word is, radicalized or shifted my perspective of how certain governmental factors, certain political agendas, certain things can ruin and lives. And it was honestly heartbreaking to learn about, especially with the discrepancies with Black and white communities, the crack to cocaine. But it also really shifted my perspective, especially with stigma. Like we learn about criminalization versus a harm reduction approach, how like we criminalize people who use drugs when a harm reduction approach has proven to be not only more cost effective, but more beneficial for the greater good. So I definitely feel like, especially as a public health major, the war on drugs comes back to so many things. It will always kind of be one of those underlying factors for so many hardships and struggles that we have still to this day. And it was, what was it now, like 50, 60 years ago when it was originally starting. So that definitely pushed me to it, and kind of learning about how certain, like these things were weaponized on our society. Like it started with Richard Nixon. There's a quote, and I couldn't give it to you verbatim, but along the lines of, we knew we were lying about people, but it was always about, gaining power, gaining this like agenda. And it's just crazy like that this information is available, that it happened at all, and that certain things still carry over to this day. I feel like I took it upon myself to research and advocate for it, because not a lot of people are aware of it, like they are aware of obviously the opioid epidemic and factors like that, but not really aware of how these stigmas, how these policies, how these statements have shaped and essentially affected our way of life decades later.
That's a very interesting topic, and the history is very intriguing as well. So,
Very.
yeah, I hope you keep talking about that because, as you say, I mean, people don't know. People are not aware of these.
Yeah, definitely.
Important for them to know. For us to know, including me.
Yeah.
Your research touches on a controversial, as you know, and deeply complex
Yes.
topic. What have been some of your biggest takeaways so far?
I feel like my biggest takeaway is the importance of education and activism, especially because the only way that people are going to learn about situations, will learn about certain aspects of life, especially in an area of misinformation, is if you dedicate yourself in time to finding the facts, finding the research, posting about it, talking about it. I will always advocate. I will always do what I can to break a stigma. And, you always, sometimes when you hear comments made or statements, you kind of think to yourself, oh, is it better just, sit here and acknowledge that I view differently? Or is it better to approach them and break these barriers one by one? Like when people use certain terminology like junkies or things like that, or speak of people who use drugs in a negative connotation. Like I feel like the best thing that I can do if I can't change the world overnight is little by little make people uncomfortable using these types of things, make people uncomfortable not having the information, or inspiring people, because obviously the worst thing you can do is argue and, oh, like I'm right and you're wrong. I really do try to form my speech and the way that I come off in a way of, I understand that you have a different perspective right now, but if you give me the opportunity to talk to you and, give you some information, I hope that I can shift your perspective in the right direction. So definitely my biggest takeaway has just always been to constantly educate myself and pass on that knowledge to all the people that are important to me, people that follow me, people that care about my opinion. And that's, I think, one of the most important things to me has always been raising awareness.
I mean, things have definitely changed in all aspects, but in terms of public health and activism, I mean, it has improved
Definitely. Yes.
a lot. How do you think public perception of the war on drugs has shifted in recent years, especially among, younger generations?
So I really do feel like, specifically with marijuana, because marijuana was a big proportion of the war on drugs. I believe it was Richard Nixon. The hippies at the time, hippies were very, very against him. They were protesting what he was doing in Vietnam, everything like that. And it's kind of put him in a weak position, vulnerable to scrutiny, vulnerable to these perceptions where like, you know what, maybe this isn't correct. So he villainized marijuana, the whole I had conversations with people in earlier years and they would discuss how marijuana was a gateway drug and so many people were so like yes that is a fact. It was propaganda. It was just something used to villainize. So because of that, I feel like specifically marijuana has taken the biggest shifts from then because at one point in time if anyone were to smoke marijuana regardless, you were viewed in a certain way or oh like you're going to be someone who ends up using other extreme drugs. But now in this day and age, specifically in America, it is legalized in many states for recreational use. It is now a big proportion of our stock market too. So that is definitely, and the fact that we still have people in for small possession charges in prison still for something that is now legalized. That is definitely something that has shifted the most. And I am happy that a lot of public figures, specifically Kim Kardashian, which is crazy. I learned in my class that Kim Kardashian has had more influence on releasing people for small possession marijuana charges than public health leaders and officials that have dedicated their time to it for 20 years. So that is definitely, I think, one of the greatest shifts, that we have people incarcerated for things that are now legalized and viewed completely differently than when they were at the time of their arrest.
Definitely. I mean, I have so many things to
Yes, like my teacher
say,
told me
but
that. She was like, I have dedicated 20 years of my life to this, and Kim Kardashian accomplished more than my team and I could in a week's time. And that really also would push for me how important activism is and how important certain platforms can be. Because I know some people are like, oh, you post on social media, that's not doing much. But to a certain extent, at times it really does. It gives people comfortability and space and inspiration to understand, like, you know what, like these types of things are what's important. Like these things are shaping perspectives.
she's definitely more influential than people think, for sure.
Yes, 100%. 100%. I fully like I was aware of it, but when my professor stated that, it took me about a week to really process
Like,
that.
wow, really?
Wow, like no way. 20 years, a PhD, and Kim Kardashian achieved more in a week.
Oh my goodness. Are there any other misconceptions about, drug policy or addiction you'd love to clear up?
I personally feel like the strongest one will always be a criminalization versus a harm reduction approach because many people are criminalized for using drugs, for possessing drugs, and a public health approach that implements more harm reduction policies. Um, Organizations like I know our mayor Parker, she just recently signed into an order that people that are arrested or incarcerated for drug crimes can voluntarily switch to go to a drug treatment program instead of receiving jail time or fines or charges, which is great. But it's also autonomy is super important with harm reduction. Like they're when it comes down to drug use, they are going to make their way into the states regardless. So whether or not someone uses, whether or not someone gets help, you can't force that on somebody. And incarcerating people, putting them in worse environments is not going to aid or help us in achieving this goal in the long run. So I definitely just really feel like the more that we push city leaders, our Congress, our mayors to focus on harm reduction versus criminalization and destigmatizing certain things is definitely super important and the biggest thing that we can focus on right now, specifically when it comes down to the effects of the war on drugs in certain states of the world today.
And that's why activism is so important,
So important.
to push them to,
Yes, to feel safe expressing themselves. And you know what? Being comfortable enough to say, you know what? Even though I was taught this thing or this was kind of pushed, I have taken the time to educate myself, look into things that I'm comfortable enough that I know that there are other people who view the same opinions as me to go out into the world and say these things, to change perspectives, to be strong enough, comfortable enough to say that myself.
Exactly. How do you apply the biopsychosocial model when thinking about modern public health challenges?
So when it comes down to modern public health challenges, like one of the repetitive themes of my course has always been the social detriments of health and how socioeconomic status and things like that can interact with, our overall health and our function of life. So when it comes down to the biopsychosocial model, I have always loved it because it kind of includes so many things that take up health and affect the body, like biologically, psychologically, socially, how these things are going to affect you. Most people that grew up with experiencing um, like a socioeconomic status like difference, they have like a higher chance of chronic diseases. They have more health problems. They have certain situations, and we look at it like, okay, well, health is just, the foods you eat, how much you take care of yourself. But chronic stress can kill you. Like living in a constant state of fear of uncertainty, that literally slowly breaks down your body, that kills you. So I feel like it is so important when examining why so much of our population is sick, why so much of our population now has problems that either were just not as advocated in previous years or heard of. Like we have a variation in rates for certain things like depression rates, people that are on psychological medications. Our chronic disease rates, if I'm not mistaken, I believe 60% of our population has a chronic disease. So we have, like specifically in America, more of our population is sick than they are healthy. So an application with the biopsychosocial model, I think it's important to look at those factors, look at all these things that are now being accepted as, a form of healthcare and how we can improve these areas. Like I've seen doctors talk about how there are situations with kids that are constantly getting sick and they know that they're sending them home to environments where they don't have, necessarily nurturing spaces or things that they need that will help them grow and ultimately shape their health and mindset for years to come.
So
So
important.
that's why I love it. Like I really do most of the things I do will always come back to environmental factors, biological factors, and social factors. What is the environment you grew up in? What certain stressors are being faced that are affecting you and your community, and maybe what health issues are also more prominent. And being able to tie that all back into, why all these things are affecting each other.
And all of those factors are connected to each other. So if one fails, the rest.
Yes,
So
yes. Like if you're in constant stress, your body will deteriorate. Like it is proven. That's like fight or flight. You're only supposed to be in it for such a short amount of time. And when you're constantly stressed, constantly worried, you deteriorate yourself. And it really is heartbreaking because there are so many things as a society that we can do
mhm.
to, prevent this, but just takes a little bit more time than we would like.
We all have to, have the same mindset, and that's a little
Yes.
complicated. So
It is. It is hard to, get people to be okay with changing perspectives, regardless of what they've been taught to believe or what they grew up believing. Because it's scary sometimes, being like, oh, maybe I'm not looking, like maybe I didn't have the information to properly look at things or assess, my environment and the world around me.
for sure, yes. Uh, in what ways do you believe health education could improve decision making at the community level?
I feel as if we had a proper health education in so many different areas. Like I learned about how we don't have a proper sex education, how most of it is targeted as pregnancy prevention and not necessarily safe sex behaviors, or even certain factors like how, when you're experiencing certain there's stressors that these will impact your way of life and your thinking. And I feel like if we are able to fully reevaluate, maybe re-implement, improve the way and what we teach people as health education, certain factors like, some women aren't able to get education on, period care or like I said, safe sex and things like that. Like safe sex is not just, avoiding pregnancy. It is also avoiding sexually transmitted infections, being able to have the comfortability to say no and certain things like that. And I feel like the more that we educate our society, especially our children, the more confident, the more empowered that people will be to make healthier decisions, to want to learn more and then apply that into their community. Because we do have issues with community nowadays and, stigmas, the way certain things are. And I do think a lot of it does come back to an improper care of how to take care of ourselves. So I think health education is extremely important. And honestly, I'm grateful to Temple and their curriculum because I have learned so much more in just, the curriculum that I've had to learn than I ever would have imagined.
Definitely. Uh, what are some overlooked factors, social, psychological, or otherwise, do you think should be part of some health conversations?
I do think that social factors, specifically and environmental hazards, need to be taken into consideration with health conversations. We have locations throughout the country that are called super funds, I believe. It's a very ironic name for what they are. And so in these locations, they're essentially radioactive waste and material sites, or they're dumping materials into the ground. You can't, it might just be like a 5 acre lot property. But in these areas, for example, most of the population is experiencing chronic diseases and significant increased cancer rates and things like that. And I feel like, you know, we are slowly understanding how our overconsumption, how, the industrial revolution has affected our environment and the world around us. But I really feel like that conversation of how, certain production measures, certain policies like super funds, that's also killing our people. Like we need to care about one another and the world around us. And I also have always been so about how our interaction with like the world and environment, how we view animals, how we are connected to the world around us has, unfortunately shifted, especially in the day of technology. So I feel like all these factors are contributing to, increased rates of loneliness, increased rates of lack of a loss of community. Because we are ultimately, yes, we are humans. We are a human species. We thrive on community. It is scientific data. It is knowledge. We need these certain things. And as time goes on, we are slowly shifting from these things that contribute to our overall quality of life and health. So I feel like it is super important to take into consideration how, policies like that, having, these materials, these things that very much affect our health and negatively impact us, and social factors, certain environments. Like I'm very passionate about how public education systems work, how in certain areas where it's wealthier, they obviously have increased taxes and better schooling versus areas that are lower income, they have not as good as schools that are 20 minutes away, and how that is contributing to certain issues that we're facing. So I'm very big on policy and interaction with the world around us. It's always, I just think it's so important.
Oh, I'm learning so much here. It's so interesting. And I mean, the thing is that some of us might not even know that it is affecting us.
Yes,
Yeah, it's incredible.
it really is.
You've mentioned a commitment to informed decision making. What does
Yes.
that look like in real world health spaces?
I feel like informed decision making is looking at the raw data, looking at factors, being able to confidently speak on how certain things are influencing like the world around us and aspects of it that directly impact us and affect us. Like I feel as if, sometimes in this day and age, unfortunately, a lot of people are quick to just even political leaders like opinion or, like, oh, like this is correct and this is whatever, like I was taught to believe this. But regardless, I really do feel like being educated on matters, having all of the data and a plan to follow is so important with informed decision making, like not making the best decision for the sake of the economy or things like that. Like looking at it like, you know what, even though this certain system might work, can we improve it? Can we do better? What research do we have that could support this? Like what isn't working? And being comfortable, being, like I care about the people around us enough, our society, my community enough to look at all of this and want to improve it, want to change it. I know if it's not broke, don't fix it. But sometimes things are broken when you kind of sit there and look at how certain systems are and you realize it doesn't have to work like this. It really doesn't. Like we have so much. We live in an age where any amount of information is accessible. And a lot of scientific data, especially us as college students, because we have access to so many databases, so many, different research that maybe other public areas might not. So I really do take it upon myself to learn as much as I can, take different perspectives, and be able to see outside of myself and think rationally to make the best decision for the greater good.
That's the best
Regardless.
way to do it too, because some people,
Yes,
are just focused on what they think and what they
yes,
been. And I think it's important to also, listen to the other side.
exactly.
Maybe you can learning from each other that could also help a lot on the discussion.
Yes, like collaboration is so important. Like I've never really been, it's not like me versus you, it's us versus the problem. Always will be.
Yes. And following on that, if you could design your dream public health campaign, what would it focus on?
My dream public health campaign. I really do. I've done a lot of work in this past year, especially specifically for harm reduction. I am so passionate and so, like harm reduction is so important because so many things in the world kind of come back to poor policy and, poor things in place that aren't necessarily focused on like reducing harm to the world around us. So I feel like my dream public health campaign would definitely be tying in harm reduction principles with dedicated research to the decriminalization of drug use and a public health approach to solving certain things that we as a society have kind of been informed and taught to villainize, to view in a negative connotation and not as a health problem because so many things, in previous years that were viewed very negatively, like mental illness in the past 20 years has taken such a huge shift from, like a very questionable to identifying it as a health problem, something that is out of people's control to an extent. So definitely a dream campaign of mine is putting the time, research, energy into a full decriminalization approach to drug use and implementing it and seeing the effects of that and then possibly spreading it, because you can't change the world overnight. It starts small. And then when something works, when it doesn't work, you have the power to change it, to do better. And hopefully it grows. So that's definitely a big dream of mine.
No, and I think you're on the right track to doing that. So,
Thank you.
what's something you've learned recently that changed how you think about your own wellness?
Something I've learned recently that has changed how I think about my own wellness. Hmm. I really feel like having, so I think that overconsumption of media to an extent is something that I've definitely taken into consideration because I'm a big, like I said, researcher. I love learning information, but sometimes learning this information hurts. Like it is so like the grief that comes with going through history, learning about things and seeing, just how horrible certain aspects of life were that impact me. And because we live in a day and age where all this information is readily accessible, available to us, it kind of restricts the empathy that you have for certain things. So I feel like I've kind of learned to be patient with myself. And although my heart is in my work and what I do as a student as I get older, sometimes I definitely remind myself that it's okay to take a step back from things, realize like all this overconsumption, like the information that I'm consuming, like it does impact me. So big part of wellness is being gentle with myself, reminding myself I don't need to learn everything and know everything and just be a machine that consumes. Like at the end of the day, I'm a human being that experiences emotions, that cares about things. And, sometimes it's okay to just sit there and take a break and have to process what I learned. And also giving myself grace too. I feel like we're pushed to be, especially as a college student, like pushed to be machines, like we believe that if we don't do certain things that we're less than or we're not as good of a student or as successful. But it's really just having the grace with yourself and being okay and comfortable with myself. Like I need a minute. Like I need to sit with it. So definitely just being patient and being able to not always have something to do, like taking that time because it's so important. Like I feel like we forget sometimes that we are,
Yeah.
a species, we are a living, breathing thing that needs certain things to function. So that's definitely a big one. Yes. Yes. And how many aspects of wellness it encompasses. Like there's a wheel and I couldn't name them all right now, but how much encompasses wellness as a whole. Because when I first would think of wellness, I would think supplements and maybe like a sauna or something like that. But it is so much more than that. It is so much more.
Yes, so
Like,
much more.
yes.
Where do you see yourself making the biggest impact after graduation?
I see myself making the biggest impact either as a local community health worker, interacting with my community, getting different perspectives, and then using that information that I not only get from, statistics and the logistical facts, but the world around me. What does the population around me have the biggest concerns of? What can I learn are the biggest struggles? But I also am very passionate on global health standards because as a public health major, although yes, it encompasses a lot, we also learn a lot about policy and specifically international policy, how there are so many different aspects in comparison to the United States versus the rest of the world. We spend the most on healthcare and we have the sickest population. Most other high income earning countries have federally mandated paid maternity leave. We are the only country out of all these high income countries that does not. Countries like, I believe it's the United Kingdom, will give women up to 56 weeks of paid maternity leave. Whether it varies, some of them it goes, you get 100% of your salary for a certain amount of time, then it's 70. But then learning this and then learning that we have absolutely zero. And for the most part, usually mothers are given, 3 months, I believe, I might be mistaken, to have no form of income and maternity leave, mind altering to me. So being able to, I feel like I see myself, I would love to work for the World Health Organization, preferably in Switzerland, given certain circumstances, and making that change, studying things that I believe are important because we have amazing leaders in so many other areas that do dedicate time to this type of research. But I would love to be a part of the group of people because public health is never individual, it's always collaboration. Like I could never do it all by myself. So being able to be a part of a team that is focused on improving quality of life beyond like in all areas, interaction with the world and others, how we view certain things is so important to me. So I feel like the end goal is always to be just a big global health figure, not necessarily a known figure, but someone that's behind the scenes that is actively working all the time to improve quality of life and, reach the same level of care across all boards.
Are there any other specific populations or health issues you hope to work with or advocate for in the future?
I definitely do like to do harm reduction, but I really do hope to work with scientists and different leaders that focus on like the interaction between humans and the world around us, how our current way of life could be interfering with, our intended biological purpose and why these things are happening. So it's very broad, but I really do feel like our interaction with the world around us is so crucial in our way of life, how, we have a decreased sense of community, how we view animals, how we view certain things, how we, overconsume and what I can do to reform that. And diseases too, like the spread of diseases, how these things manifest in certain areas, why certain countries are happier, why, like, what can we do to increase happiness? Like, I'm pretty sure if I'm not mistaken, the world for the United States, we had a very low happiness rating. Like I think it was like 24% of the population is happy, the rest are is something else, just not. And I would love to, do anything I can to fix that, because public health is not just health. It's not just nursing. And it's not just, infectious disease. It is not just epidemiology. It is overall quality of life and how that all ties together.
There's so many things we can improve on, so many things. If we keep comparing ourselves with other
Yes.
countries, we can see the differences very
Yes.
clearly.
Yes, especially like learning that we spend the most on healthcare and have the sickest population. It's just always been like a big blow for me. Like we have this information readily available and we don't do anything. Like you would want your population, your country to be healthy, to, have everything that they can to become the best that they can be. So it is. We have a lot to learn from other people. And I think that the second we stop fighting with one another, viewing it as us versus them, or like we are all one species of people. And if we all came together, collaborated, we could change so much. We could achieve a quality of life we didn't think possible. So that is definitely a big motivator for me.
Well, and with that, I end this. The record.